So it was later in a meeting, I actually did say something to the mom. This is the whole part about being brave, and I've decided I'm not going to be quiet anymore. And if it means risking my job, that's what I do. But it's so important.
All right, so people, listen up. You know how we feel about the HPV vaccine. Please, if this story doesn't do it for you, look at all the other stories. Hannah Robinson, Colton. The list goes on and on and on. How many more do you need to hear before you understand how dangerous this vaccine is? All right, let's hear from you both. So what's your name?
My name is Vicki Carey.
I'm Caitlin Carey.
It's lovely to have you both here. We did meet you last night, and you are, how old are you now?
I just turned 16th on the 9th of September, and I have been dealing with this for about 2 years now.
All right, so let's start off by going back to before you had your first Gardasil vaccine. Tell us about the type of person you were. What did you enjoy doing? What could you do then?
Oh, I was so active. I did karate. I was almost a black belt. I could take down a 40-year-old black belt who used to spar with me. I used to walk about 3 miles after school, and I went to a very open campus school where you have to go between building to building, and I used to wear a pedometer every day, so I walked about 10 miles every day, not including doing karate 3 days of the week, and then the other days of the week I wasn't at karate. I would walk about 3 miles or
You've
jog
got some
them.
pictures of this. Have you got them on you?
Yes.
Have a look at that. Well, carry on talking about you sent me these wonderful pictures of you doing karate, and you're very active.
Definitely. I loved being active. I loved going for walks, walking the dog every day, and just going places with friends, and just doing a whole lot of things, you know. And then
So there she is, doing karate, really active. And is that, so you were, what belt were you?
I was a green belt.
A green belt.
She was one belt away from black belt. Breaking the board, she had the strongest kick you'd ever see.
See? Active, fit, young girl. All right, so what were both of your views on vaccines?
We didn't really think much about it. We thought they were safe. We heard so much in the media about how safe and efficient they were, and we thought, well, we don't have smallpox anymore. We don't have polio anymore. We were thinking everything was safe, you know?
And we trusted. When I took her for her 12-year visit with her pediatrician, who knew her from the time she was 3 years old, he said it was time for the Gardasil vaccine, and I hadn't researched. I wish now that I had, but I asked him, would you give this to your own child? And he said, absolutely, it'll keep her from having cancer when she's older. And he said, I plan to give it to my own children. So I trusted him, and it was my biggest regret to this day.
So he said he planned to give it to his own children.
Yes.
And you were telling me some of the other things that the doctor told you.
I was 12 years old. I was in about 7th grade, and he was saying, all right, so you're starting to mature, you've had your period for a while, you're going to be sexually active soon. And I was like, no, I don't think so. I'm 12. I'm still a kid. And I know a lot of people when they're 12, they think they're grown up, but I didn't really have any friends that were sexually active. I didn't really plan on being sexually active for a very long time. And he said, all right, so we're probably going to need to put you on the pill if you're not already. Are you on the pill? I was like, what? I thought that was for people who were older, like in their 20s. And he was like, no, you should try and be on that soon. You should definitely be on birth control soon, and I think it's time for Gardasil. And I didn't know what that was, but he told me it prevents cancer. And I had friends who had severe cancer. I knew somebody who almost died of cancer, a neighbor of mine. It scared me so much. And he said, well, HPV causes cancer, and if you get this vaccine, it's a series of 3, if you get it, you won't get cancer. And I was like, oh wow, oh my gosh, sign me up. I don't ever want to have cancer. I don't want my hair to fall out. I don't want to go through chemotherapy. And it's kind of ironic because my hair is falling out now, so.
She takes a shower and there's this much hair in the shower still. It's
Okay, we're gonna get
Yeah.
onto that because it's horrendous what's happened to you. So you heard about this vaccine that was going to stop you getting cancer,
Hmm.
and you were both there together while this was going on. How did you put up as a mother with him talking to your 12-year-old daughter about contraception and?
Well, I'm a high school teacher, so I know students are sexually active at a younger age, but I also know my daughter, and I knew she wasn't anywhere near that. And I said, no, absolutely not. She's young. I understand where you're coming from, but she's young and she's not that kind of kid, and we don't need to do that. It's not even an issue. So I just shut it down. But I didn't shut down the Gardasil talk because I trusted him.
Of course. So you had it's a series of 3 shots.
Yes.
Isn't it? So you had the first shot, and how were you? Did you just have the one shot that day?
Yes, that day. And she didn't have any reaction that we saw the first shot. And I realized we had to go back for the second and third.
And so how long after the second one?
Oh, maybe weeks, 2 weeks. And I didn't put it together till later because I didn't have it in my head that a vaccine could cause the symptoms that she was having.
At any point were you told by the doctor that there were any side effects whatsoever to this vaccine?
Never.
No, he said,
Never.
and I quote, "It's completely safe. There's nothing wrong with it. I would give it to my own daughter. I would
He said
give
he
it to my
planned
own
to give
daughter."
it to his own children.
Hmm.
So no, and in fact, they didn't give us. I remember getting a sheet. I didn't keep it, but I remember getting a sheet that they put together. It wasn't the insert, and it wasn't anything official. It was something the doctor's office put together, talking about how safe it was. And it's very rare that they might get lightheaded or something and need to stay at the visit a few minutes before they leave. That was the only thing that we were told. Not that she would end up disabled, for sure. If I had any inkling that she would be suffering, I never would have done it. But no, we were never told.
So you went back for the second one?
Went back for the second one, and I would say maybe a couple of weeks later, maybe 3 weeks later, she started having this barking cough, and she was diagnosed with lung spasms. I brought her back to the same pediatrician and said, "What's going on?" She had asthma as a child, so they thought it was the asthma kicking in. But she'd never had lung spasms before, never had dizziness before, and that's when it all kind of started. And she had just, for the next year, just one thing after another with bronchitis and sinus infections and more bronchitis and more lung spasms. It was really kind of centered in the lungs at that point. And she got her third vaccine in July of 2013. And again, as I said, that whole period, that whole year after, it was just constant sickness and antibiotics and more antibiotics. And it was then in October 2014, Caitlin was diagnosed with hemiplegic migraine when she was 8. It's a familial condition. It's genetic. We've been tested. I get it too. They're migraines that cause paralysis on one side of the body or weakness. And it's transient. You have a migraine, you get that, and it goes away. You're fine. She was medicated for it for a couple of years and then was fine. She hadn't had a migraine in 2 years. So when things started happening, she was getting more headaches, dizziness, and all this happening, and weakness.
After the second vaccine?
After the second vaccine. They thought it was her hemiplegic migraine coming back again. But I said it's different. She had both legs weak. She couldn't walk. I'd have to walk her to the car from school. So, but it was in December of 2014 when she had a sinus infection. And the doctor gave her a Z-Pak, antibiotic again, that within 20 minutes of taking it, she came to me and said, "Mom, I feel like I'm going to vomit." And within 5-10 minutes, I was struggling to keep her alive.
I remember it was the scariest, one of the
Still
scariest
just after
moments.
the second?
After the third. This was after
Oh,
the
now
third.
we're after the third.
Yes.
Okay.
I remember my eyes were rolling back in my head and my lips were turning blue, and I had had asthma attacks before, and this was much more severe. I remember my heart was pounding and I just couldn't breathe at all. I couldn't speak, and I felt like I was going to pass out, and I was so scared. And then I went to the hospital. They said your potassium is dangerously low, put me on a potassium IV and sent me home.
And there was no reason. I mean, that's when I started looking. That's when I started trying to figure things out, because there was no reason for her to be hypokalemic, having low potassium. Low potassium comes from vomiting, diarrhea, anorexia, dietary things. There was no reason for Caitlin to be hypokalemic and to be weak and to be and at the time she also was diagnosed with a prolonged QT interval in her heart, so which is deadly. It can be deadly. So I was just trying to figure out what happened. This kid was healthy. She was in high school, the same high school where I teach. She was in karate, and now she's debilitated. She came home from the hospital that day, and she hasn't been the same since. She was weak. She was having convulsions. She couldn't walk. At one point, she was like an end-stage MS patient, in the bed, couldn't lift her head off the bed. I had to physically transfer her. And then she'd have these episodes of this paralysis. It wasn't just the left side. It didn't come with a headache. It was just this weakness where she'd be sitting like this talking, and all of a sudden flop over like a rag doll. But conscious through the whole thing. And then screaming in pain. Screaming on the couch in pain. And there was nothing that would help. It was just, that's the hardest part, is seeing your child in this kind of pain and agony, and nothing would help. We went everywhere to try to get help, all the major medical universities. We were told at one point by a doctor, take her for a walk on the beach. I kid you not. Get her feet in the ocean. Take her for a walk on the beach. I said, she can't walk. A walk on the beach is going to help her? And then you hear, well, she's a teenager. She had anxiety. I had anxiety from this. She needs counseling. I took her to a counselor. I'm a licensed clinical social worker, in addition to being a high school teacher, special ed. I know my child. But I said, all right, I'll take her to counseling. Counselor said there's no evidence at all of conversion disorder in this child. There's no trauma in her history. She has great supports. She's coping with it. The counselor said to her, she's coping with this better than I would. And then we got some neuromuscular testing done. And the technician that did the neuromuscular testing, they just start with a baseline. They stick needles in the hand and then the arm.
It was, I think, right here, right here, right here, and I think up here. And they started with the shock part, where it's an electric current, and it goes through here, and it's to get a response. You're supposed to go like that. I didn't move. They said, you're not getting any response whatsoever. They were saying, you are the first person in 25 years I've ever seen fail the baseline. And so, instead of just doing it on the area that was affected the most, that I was supposed to be testing for, they did this for about an hour. They tried this hand, they tried my foot, nothing.
And they had no explanation. Their response was that they thought that they should redo the testing, put her through another 3 hours of torture, because they couldn't figure out what the results meant. We know now what the results were and why they don't understand the results. It's damage from this vaccine. But I hadn't put things together. And it was only when I went in desperation on social media and put her story out there with videos and just crying out for help that another mom contacted me and asked me if Caitlin had the Gardasil vaccine. And I thought she was crazy, I'll be honest. I thought a vaccine wouldn't do this, and plus she had vaccine now a year ago. Why would I think a vaccine would cause this? She said, please, your daughter's story from the potassium dropping, the paralysis, the allodynia, which is that pain that you can't touch her. I couldn't hug my child for months because it hurt.
I had to wear loose, soft clothing, and at times I couldn't wear anything because it was just, even the slightest little touch felt like somebody punched me. Like if somebody grabbed onto me, it felt like they broke my bones. I remember having these attacks, we called them, where my head would fall over. My mom would struggle to try to pick me up, and I would be in so much pain. I would just scream from it because it was just like punching somebody in a bad bruise whenever somebody just touched me. I used to have things with the few friends that still stuck by me after I had to leave school. Instead of a hug or something, you'd have to do a pinky touch because there's just nothing.
Tell me about your friends. How did they react to what happened?
Well, I used to have a lot of friends when I was going to school full time. I had guys always told me they had crushes on me. I had so many just really loyal, nice friends, always texting somebody, and I was a straight A student as well. But I don't really have anybody now because after being out of school for about 2 months, people just thought, well, she's gone now. And people who asked me, hey, what happened? And I explained, I'm in a chair now, and I've been in bed for a long time, and I can't walk. Or I have to use a cane to get around on good days, or a walker around the house. And there's a lot going on with me. And at the time I didn't know it was Gardasil, so I just said, there is something wrong. They said, oh, okay, and never spoke to me again.
She still does have a couple of her friends from when they were very little that stand by her and are supportive and try to include her in things, but it's difficult. She went to a party the other night and had to come home because she had a paralysis attack in the bathroom.
And just you walking on the bus, just walking up these steps here, you get on the bus was a major ordeal for you.
Definitely. I'm surprised I didn't have an attack from it. I was clutching my chest. My chest hurt and it was pounding. We have stairs in my house. I have to take it about 2 steps at a time. It takes me 15 minutes to go up and down the stairs in my own home, or more than that, because I have to sit and I have to rest every few steps, or else as soon as I get to the top, I'm out. It's hard.
Now, the pediatrician who told you that this vaccine was safe, I really hope you went back and told him what has happened to your daughter.
Oh, yes, I have. Well, what happened was I went and requested the records. I knew that at this point, when this other mom came to me or contacted me and said, please look at the vaccine because my daughter's having the same exact symptoms, I started doing the research. Too late, but I did. And that's when it all came together, and I saw so many stories, as you see, of the same kinds of things that these girls are suffering with, and now boys too. I went and requested her medical records, and that's something I suggest everybody does, by the way, because I found glaring errors in there. They said that she had ADHD, and there was an entry in there that was obviously not her. She was 12 years old, and it said doesn't play well with others, getting in trouble at school. We're going to restart her stimulant medication.
Doesn't share building blocks.
Yeah, it was,
that was
so
like,
not her. So I recommend
At 12
everybody.
years on, at 12 years old, you don't share buildings.
Right.
I was reading Romeo and Juliet, and they were saying she's having trouble playing on the playground
So it was
and
clearly not
sharing building
her.
blocks.
So
an error.
basically, some other child's details are put on your medical records, and some other
Yes.
child has got marked down they had Gardasil.
Gardasil.
It's probably
Yeah.
age
Exactly.
2.
And they
Exactly.
said, and they said, they tried to defend it, saying, she has anxiety. And my mom was like, it's because she can't walk.
That's why she has anxiety.
Yeah, they're like, and doesn't play well with others and getting in trouble at school. She's never had detention. She's never been suspended. The worst thing that ever happened for her getting in trouble was her getting her card flipped in 2nd grade.
For talking too much.
Yeah.
But, so I recommend everybody get their medical records and really closely examine them. But that's when I started putting things together. It wasn't until then that I really sat down with the medical record and a piece of paper and I wrote down every date and every visit and what happened. And then it was crystal clear to me. It was after the second Gardasil vaccine that these problems started happening. And I didn't put it together until then. And then as soon as I did that, and I looked at on the internet and all these young women all over the world that are having similar issues after Gardasil, it all
And there's so
came together.
many.
So many.
Ridiculous amounts.
And
It's
I'm a high school
insane.
teacher. So, and I'm in tune, I teach special education. We had a girl, and obviously I won't say her name, but she wanted to be in the Special Olympics, and she needed to have a physical exam done in order to qualify to be in the Special Olympics. She went to the doctor. She came back, brought in the paperwork to my colleague and friend across the hall. And the day after her visit, she was complaining that her legs were weak and she couldn't walk.
Hi.
And I said, "Hi, William."
Sorry.
I said, "Did she get the Gardasil vaccine?" Of course, that's my first reaction. And we pulled out her paperwork for the Special Olympics, and the day before she had had the Gardasil vaccine. So of course I have this dilemma as a teacher and as a mother of an injured girl. What do I do? Do I contact this mother? Do I not? So it was later in a meeting I actually did say something to the mom. This is the whole part about being brave, and I've decided I'm not going to be quiet anymore. And if it means risking my job, that's what I do. But it's so important. And I asked the mother how our girl was feeling. She's in my class. And the mother said, horrible. She's been in the ER countless times with asthma, lung spasms, and this weakness in the legs, and they don't know what's wrong with her. Now she's on a ventilator, not a ventilator, a nebulizer every morning before she comes to school. She never had those problems before. And that's when I decided to share with the mother what happened to Caitlin. I didn't say, your daughter's been injured. I said, this is what happened to my daughter. And the mother said to me, I knew it. In my heart, I knew it was that vaccine because she never had the problems until she had that vaccine. So I see it. I have another colleague whose daughter had a seizure disorder, and she was seizure-free for 3 years, had the Gardasil vaccine, and the next month is having her
The
seizure.
symptoms for Gardasil victims are so similar, so striking. The more that we're going around and seeing, it's just I can tell a Gardasil victim now.
Mm-hmm. Exactly.
And the seizures they have are different from the seizures of, say, the MMR vaccine child or another. It's a very glaring, obvious Gardasil
Yes. Yes.
seizure. Right, now has this been reported?
Yes, to VAERS. And also I updated the VAERS. I think that's important to share too, that as you go, it's important. Unfortunately, we keep getting new diagnoses. Caitlin now has cysts on her thyroid, and she has autoimmune disorder. She's been diagnosed with that. So I updated the VAERS report as well after she was diagnosed with that.
Wow. It's criminal, and I'm so sorry. Do we know what the long-term prognosis is for you?
I have no idea.
Yeah,
Because no one will acknowledge it.
It's Gardasil. That's what I think.
But
My long-term diagnosis, it's a Gardasil injury, and I wholeheartedly believe that. And I'm not the type of person who didn't trust vaccines beforehand. But I have seen vax twice, and I know what happened to me, and I've talked to other girls who have had the same exact things as I have. Just, I wish everybody could see it, because it's eye-opening, it really is. And it's just, you see what happens, and a lot of people just refuse to, and it's ridiculous, really.
And that's the criminal point now. That's where I am, because we've been everywhere to try to get help. And, you know, we get, that's interesting. We don't know what it is. Or counseling, you need counseling. Well, you tell me where counseling, I'm a licensed clinical social worker, as I said. It's my profession. Counseling is not going to take care of nerve damage to this child's arms. It's not going to stop convulsions, and it's not going to stop hypokalemic periodic paralysis or allodynia. So there's no, I've come to the decision that Western medicine does not have our answers.
Are you seeing a chiropractor?
We had been seeing a chiropractor, and unfortunately what happens is that you don't know what the day is going to be like. We ended up canceling so many appointments, I felt terrible. So, you know, but we're getting back into
These guys seem
chiropractic.
really nice. We'll go and have a chat with them in a minute.
Yeah.
Definitely.
Yeah. And clean eating, just organic,
Yeah.
gluten-free, dairy-free, clean.
What's your message to other girls that are 12, 13 that were thinking about going to, well, I mean, I suppose it's their parents, really. But what's your message?
When you see those ads that Merck puts out with a child dying of cancer, and then it goes to them as a little kid saying, Mom, Dad, you could have prevented this. Don't believe that. If there are other people getting it that you know, don't believe that. It's not worth the risk. It's not. it's just not worth it. I wish I would have known, because then I would have been a junior in high school now. I would have been in school, at the school my mother works at. I would have had friends. I would have been able to do things I want. I would have been able to be a black belt by now. I would have still been able to jog and go out with friends. I would have been able to stay at that party I tried to go to just 2 weeks ago, where I had a seizure on the floor and had to go home 30 minutes in. It's just not worth it. It's hell. I have episodes where I feel like my whole body is on fire, and they just come randomly.
She's like that iconic picture of the little girl, I think it is in Nagasaki after the atomic bomb, running through the street on fire, naked. Caitlin has times like that where she'll say, "Mom, is it hot in here?" And I'll say, "No, honey," but I know it's coming. Her whole body feels like it's on fire. She has to get naked and stand with her hands out, because even skin-to-skin contact with her arms down is too painful.
And skin gets flushed and red, and right now I have skin issues, and that's why it is right now.
Hi, Billy.
Hi, Bill.
That's great.
So sweet.
And so, as a mother, here's the thing. It's the parents that generally make these decisions because the child is 12 years old. What message do you have to the other parents that are just about to go into their doctors and do the same thing as you because they believe they're doing the best thing for their child?
My advice is do your research. Don't go in there blindly trusting. No matter how much you love the doctor. We loved her pediatrician. He'd known her since she was 3 years old. We adored him. And it was a mistake. It was a mistake to blindly trust what he said. If I had researched, if I had done my research, if I had talked to other parents before that visit, my daughter would be healthy today. It is not worth, like you said, Caitlin, it is not worth the risk. I don't care how rare they say it is. If it's 1 in a million children that is injured or killed by this vaccine, do you want your child to be that one child? Is it worth the risk? Look, pap smears can detect cervical cancer very well. The technology has improved, the science has improved. So is it worth the risk? It's not. The child lost her childhood, her adolescence, and who knows from here what she's lost. I don't know, because things are still unraveling, things are still unfolding. She has more damage as we go. It's not getting better. So it's not worth it.
Are you that pediatrician? I really want to know. What did he say? Has he ever said sorry? Acknowledged it?
No,
They wouldn't even acknowledge that they had the incorrect record.
they wouldn't.
You know,
He told me to take a vacation to Colorado, smoke some weed,
Yes.
and go to the beach.
Wow,
I
stop,
forgot
stop,
that.
stop,
Yes.
stop.
I totally
The
forgot.
pediatrician who said this vaccine was safe told you to go to Colorado and smoke some weed. And is he still practicing, this
He is.
pediatrician?
He said,
He
you
is.
just need to relax a little.
This is a pediatrician that wanted to give you contraceptives at 12, talk to you about being sexually active, give you the Gardasil, told you it's completely safe and he was going to do his own child, and now he's telling you to go to Colorado and smoke
I totally
some weed.
forgot
Unbelievable.
that. I blocked those things because it's so horrific. Yes.
And
You really do need to report him to the medical board. I'm
Yeah.
sorry, I know he was your friend,
Yeah.
but look what he's done to your daughter.
Yeah. Yeah. You're right.
Please do that.
You're right.
Because he's going to be hurting other people.
Yep.
You guys are getting so much love on here. Everyone wants me to tell you how beautiful you are and how beautiful
Thank
your
you.
skin is. Which you keep
Thank
telling
you.
me how beautiful your skin is over and over again.
I'm afraid my skin's really flushed. I have a skin disease.
No, they're
And
saying it's beautiful.
it's not blush. It's keratosis pilaris. But
Just say thank you.
thank you.